The professional ideas and opinions expressed in this podcast are mine and do not reflect those of any current or past employers. Hello, and welcome to the Make It So podcast. My name is Dr. Robert Groves, and I'll be your host for these podcasts. And this is our very first one. So we're going to give you a little bit of background, and I'm going to introduce you to our guest today and ask him to introduce himself. But we've known each other for several years now, and it turns out that the company that Kaushik Vaswanathan founded and runs is called Promptwell. And it's a company that I'm involved with, and it's also the sponsor of the Make It So podcast. So, a very important guest today. He's the guy footing the bill for the whole deal. And so, Kaushik Vaswanathan, just introduce yourself to the audience and let them know where you came from, where are you going?
Yeah, thanks so much, Dr. Groves. Super great to be here on the podcast. I think very excited for us to also sponsor it. And yeah, quick way of introduction. My name's Kaushik Vaswanathan, CEO, co-founder of Promptwell. We used to be called Risk Averse, just recent rebranding to Promptwell. So just FYI for any of the listeners out there. And really kind of, yeah, quick summary on my background. We're a Boston-based company. I grew up in the suburbs of Boston, went to school here, then basically long story short, I was planning to go to medical school. Ended up actually applying to med school, kind of getting through the full process, and ultimately around 2 months before had to make the
Wow.
decision, ended up not going. So as you can imagine, my parents weren't necessarily thrilled in the moment, but really started this with two of my closest friends, Mike and Zach. Mike, who's our chief product officer, and then Zach, who's our chief technology officer. Knew Zach from high school, Mike from college, and I think all of us had like very much a passion over like healthcare. We've all, I think a lot of people in the audience as well, have probably had, unfortunately, like family members who were diagnosed at late stage for a chronic condition and just needed help to navigate the area and the complexities of healthcare. And that's really what we kind of eventually pivoted to. We kind of did 2 to 3 years of pivots. Dr. Groves, we met along the way during those pivots that we did. And I think ultimately landed on what we're doing with Promptwell right now, which very simply, we kind of look at the healthcare ecosystem and you look at just overall general ecosystem in general. It's flooded with digital outreach. You can look at any industry, right? You get promo codes, you get financial alerts, you get healthcare reminders. Everything is kind of coming together. Each person gets probably hundreds of messages, whether it's emails, texts, phone calls per week. And it's very hard to actually pinpoint and decipher through that. And I think from our side, healthcare is probably the most, I mean, it is the most important of them all to actually get that message through to the end patient. So currently in the current state, whether it's payers, providers, uh, VBC vendors, the ones who go at risk, they have such great clinical programs downstream, but that top of funnel engagement is still a little bit archaic from what we've seen, where you still see low utilization rates, low quality gap closures, and everyone's starting to get incentivized now that kind of the VBC realm and then also fee for service is kind of decreasing a little bit. But the core aspect is you need to get someone's attention. Once you get their attention, then you can educate them and get them to the program that they need to go to. So from our perspective, if the first attention-seeking engagement doesn't get someone's uh, eyes to look at the message, that's the biggest failure. And ultimately, they'll never know that a program actually exists. So that's really where we sit on. We're actually that intelligence layer at the end of the day, where we're looking at healthcare data and figuring out when and how to actually reach someone and get their attention. So you can imagine that we're doing text, email, postal, all these different channels and pinpointing just how can we get Kaushik or Dr. Groves to actually go for an annual wellness visit. and what time do we have to ping him through a text or an email, as well as what message do we actually have to get in front of him to make him take that action. So I'll stop there, but that's kind of the core goal is we're trying to reinvent the marketing landscape and really be more of that intelligence layer that sits on top. We can be the best models that can ultimately get a patient to the care that they need to get to.
Yeah, that's really critical, Kaushik. And let me give a little bit of context for our listeners and viewers. In my prior role that I left, a little over a year ago, I was with a payer provider company called Banner Aetna, and we ran into Kaushik and his team along the way. My job was vice president of innovation. And so I was obviously looking for ways that we can improve the delivery of care. And we focused on Arizona because that's where we were based. But one of the things that struck me very early on about Kaushik and his team was that they didn't give up. They kept at it, and as you know, went through a couple of pivots while we were engaging with them. But I saw the potential here, and there are two things that caught my attention. One is this is a team that basically always did what they said they were going to do. And trust is huge in healthcare, particularly now when it's become more and more difficult to gain that trust. And this was a team that did that very quickly with our team. And I also want to point out that my boss at the time, a fellow named Tom Grote, who has also since retired, used to say that patient engagement is the holy grail. What did he mean by that? He meant that we've got all these great programs, as Kaushik mentioned, and we can manage diabetes, we can manage heart failure, we can get folks in for their annual wellness visit, we can make sure that they're aware of things that are available to them. But we only got single-digit engagement for all of these great programs, and so the question was, how do we do a little bit better? Let's move that dial a little bit and see if we can get more people to pay attention. And what Promptwell, previously Risk Averse Health, did was do that in a way that's very unobtrusive. There are tricks of the trade and psychology, et cetera. But the beautiful thing about Promptwell is what it does is really it's complicated to figure out, and that's why there's AI involved. But it's really a simple concept. It's intuitive. It's easy to understand. If let's say they're trying to reach out to me because I haven't filled my prescription or whatever it is that a message that the system wants to get through to me, what the AI does is simply figure out what day and down to the hour am I most likely to pay attention to that message and to open it and therefore to take action. And so it's not trickery. It's basically meeting my needs by delivering that message when I'm most likely to address it. And I don't know, Kaushik, you want to talk a little bit about what we found with using that methodology of simply delivering messages when people are open to them?
Yeah, yeah. And I think actually kind of going off your point, one of the big things probably over the last 5 years or 10 years even has been, I think the data that health plans and health systems have is a little bit more consolidated now, where we can even start to analyze these trends. And I think also over the last 10 years, it's been very much how do we get the best clinical programs downstream. But at the end of the day, if you're attributing 10,000 lives to a group and they only enroll 10 lives, for those 10 patients, that's fantastic. But on the grand scheme of things, from your buyer's position, you're looking at it and saying, okay, the ROI is just not there. And again, it all kind of comes back to how do we initially just get a patient to sign up for that program or service that they should be utilizing. So I think the data was a huge one. And then, yeah, I think from what we saw from our early results, was very promising. We basically were able to close to 3x the top of funnel engagement. So you can think of kind of the inbound phone calls, clicks, just emails being noticed. And then ultimately, I think the big thesis is if you get more eyes on these content and the educational material, more people will actually convert into the program. So we did that with a few of the diabetes group programs that you were partnered with at the time, as well as behavioral health, where we're able to basically close to 10% absolute percent, or but if you think about it, it's close to up to 7x uh, increase the enrollment. And ultimately, if you increase the enrollment, obviously the ROI is there from the clinical standpoint. And I think the last thing that I'll say is it allowed, I believe, and you can speak to this, Dr. Groves, it allowed your team to figure out, okay, what programs are providing the correct ROI for us and which ones should we reinvest in as a result.
Yeah, absolutely. And the other thing that I would point out is that it is uh, automated to a large degree, much more so than a lot of the options that are out there today that require somebody to sit down and figure out when each message goes to whom. And, there's this whole map you have to go through to figure out who's going to
Yep.
do what when. And this really is automated, and we let the AI decide. You can set parameters, and if you don't want messages to go out on Sunday, which by the way would be a mistake, because that's one of the biggest days for folks having time to open and look at messages. But if you didn't want to do that for whatever reason, you can say that, or we only want them to go out between this time and this time, or yeah, we want the campaign to last 2 months. All of those are parameters that can be set by the entity. But the bottom line is within those parameters, the AI engine does its work, and it's really highly automated. You set it and forget it,
Yep.
essentially.
Yeah.
So tell us a little bit. I'm curious. Give us some perspective on your team. Tell us a little bit about Mike and Zach and what their background is and where they came from. Give people an idea of who it is behind the scenes that's making all this happen.
Yeah, so I'll say they definitely do most of the heavy lifting, definitely carry the team. And Mike, so yeah, again, like met him, actually we grew up in adjacent neighborhood, so kind of same hometown and then same college. And he was about to go to physical therapy school, and really had the firsthand patient interactions. So I think when you meet Mike, the first thing that anyone ever says is he's so compassionate and so empathetic as well to individuals and listens first. I think that's the number one thing that you always hear is he's a very good listener. And I think that's one of the biggest characteristics that you can have when starting a company like ours, but then also when you're interacting with the partners and clients of ours, is listening to their problems, figuring out, okay, can we solve it? If we can't solve it, do we know people who can come in and help solve that specific issue? So Mike, specifically on the business side and personal side, yeah, again, he's worked in physical therapy, seen patients firsthand. He's also gone through many surgeries himself, so he's been through the process of navigating care. So firsthand has experienced some of to your point, those one size fits all type of campaigns and outreach mechanisms where it's not really tailored to the actual individual level. Partly because the technology hasn't existed, but again, the timing, I think, of all this is definitely helping a company like ourselves grow. Um, Zach, on the other hand, he, again, chief technology officer, knew him since high school. He went to Michigan, was always the type of person who would stay up late at night. It's the typical coder where it gets to 10 p.m., gets a wave of energy, works from 10 to 2, then like takes a maybe quick nap and then back at it the next morning. So we always joke we don't know how he gets enough sleep, but I think the big thing with him as well is just he's had family members who have been diagnosed at late stage for a chronic condition. So everything's very mission oriented. I think from a culture perspective, also our team they're growing. We're growing as a company. I think now we're definitely having the perspective of, at the end of the day, we need to really make sure that we continue to enhance the models and not just be complacent with where they are. Yes, you can be at 3x engagement or you can get that up to 7x enrollment, but it's like, okay, once you get that, how do you actually make that better and how do you refine it? So we put a lot of emphasis on these models. At the end of the day, that's our big goal. And from a team perspective, it's definitely a very tight-knit group, but we definitely all have the get it done mentality when it comes to this.
Now, where does the content come from, Kaushik?
Yeah.
We've talked about the timing of the messages, but what about the content? How does that happen?
Yeah, so we actually have multiple ways when we're working with a partner. For example, when we partner with any payer, most of the time they'll have pre-approved content that they'd like to use. But then when we partner with some value-based care organizations who we're working with, they'll actually ask us to help create content. And in that case, we have multiple ways. We have copywriters on our team who can help, who have been industry experts. But then we also partner with few marketing firms to help build that content. So we try to give options to the end customers. I think from our perspective, it's our goal is really just how can we get the first iteration out so then we can quickly learn on the patients and then being able to hyper iterate. I think that's really the big benefit of a system like ours is again, you don't have to necessarily send batches of messages and you actually have an intelligence layer behind it so you can hyper learn. It's not so much one-to-one A/B testing. It's more of like that hyper A/B test where if you have a million members who you need to engage, you should have a million unique journeys with different content variations, where you can quickly gather, okay, what type of populations respond to what best. Very short way to put it is most of the time, it is for the first iteration, it's pre-approved content, but then when we do have those iterations and try to continue to improve it, that's when we loop in some of the partnered marketing firms that we're working with, as well as our copywriters.
Perfect. Now, what kinds of organizations, who does who are you selling to? What kinds of organizations are you looking to that can use this? I think people get that intuitively, but go over a few of the kinds of
Yeah,
organizations that might benefit from this
yeah.
technology.
So we're partnered with payers, primarily on the Medicare Advantage, commercial, Medicaid side. So kind of all three facets there, because again, I don't think there really is a market that wouldn't want more engagement. And
Yeah.
then even with the health system, with health systems, we have a few partners who are more on the at-risk side. So we're working with their at-risk populations, as well as a few groups who were now working on like the fee-for-service side. A little bit different there. It's more about how can they get some of the new initiatives that they have out to the public. So then the public comes to them whenever anything comes up. So more of like that recruiting side of things. And then the last one are these digital health and clinical delivery companies. So the ones who are partnering with the payers, they go at risk, get attributed members, and ultimately they're in charge of taking care of those patients and members. So those are really the three categories that we're focused on. Again, it kind of spans the full healthcare ecosystem besides pharma. I think at the moment we're focused on those. Ultimately, we do see this as becoming a larger benefits type of uh, play for us, where we will start targeting employers as well and uh, benefits teams and trying to figure out partnerships there. Yeah, just for context, I mean, it's all healthcare at the moment, and I think mostly those three players have been the top focus for us.
Perfect. Perfect. It's interesting to me that, well, first of all, what I'd love to ask you is what advice would you have for young entrepreneurs who have an idea and they're trying to figure out how to get some traction? You've obviously been successful in getting some early traction and some customers that keep coming back for more. What advice would you give to a young entrepreneur, even an old entrepreneur, about how this works and what you've learned along the way?
Yeah, I think like the big one, probably more so for the young one, just where putting myself in like 5 years ago, those shoes. I mean, when you're coming in to any industry, and if you're going to a new one, you need to obviously build like a network of champions. So I think it all comes back to relationship building. At the end of the day, people want to work with people. They don't, yes, the tech could be the greatest thing in the world, but if the folks behind it or the company behind it isn't someone you want to work with, you're not going to as a buyer. So it's very much relationship building. I think the other thing, so that's kind of the first advice is just what we did early on was we would have calls with mentors, and we did this with you, Dr. Groves, if you recall, where we'd have calls and then basically 2 weeks later we'd come with like a new idea and pitch it. And every 15-minute block of time that we could get from you was so valuable because it enhanced our relationship and ultimately helped obviously kind of with the intros and then meet more of the team and everything there. So I think it's the relationship building aspect that a lot of groups uh, either forget about or they don't necessarily look at as thoughtfully, in my opinion, where it becomes much more transactional. It's like, hey, if I do this for you, you need to do this for me, which is obviously great in a lot of cases. But I think at the early phase, it's like you just got to get your network, get those first few customers, get the references going. From the client perspective, I will say it's listening to the clients, the biggest thing for us. Just making sure the client feels like they're heard. We always try to lead with that. Ultimately, we can come back to them and give our thoughts, but you at least take into account what they're looking for and what their problems are. At the end of the day, I think every single client of ours and partner will say the same thing. They don't want you pitching them like the problems they already know. They want you
Yeah,
asking,
yeah.
hey, what are your problems and how can you solve it then? So it's more reactive.
Yeah, yeah. You touched on a couple of themes that are near and dear to my heart, curiosity and connection. I think those two things drive innovation and drive successful companies. The curiosity part, you've talked about listening very carefully and asking questions, figuring out exactly what the problem is that your customer is having instead of coming to them with a solution. You come to them and ask what's the issue, and that's how you ended up pivoting to what we're doing now is by
Yep.
asking those kinds of questions and discovering what the real need is. So curiosity is key. And then connection, I don't think you can overplay that. You're right. I mean, even in the age of AI, when people are having relationships with bots, we all
Yep.
crave
Yeah.
human connection. We really
Yes.
do. And that's the way that you build trust. And I've said before, and I still believe that it's true that the new currency in healthcare is trust. That's
Yep.
what's most lacking across so many aspects of healthcare today. And so building those connections and building trust between those connections is going to be critical going forward for anybody who wants to be successful in this industry. And it is incredibly complex. I'm sure you went through a learning curve when you first got involved with this.
Yes. Yeah. Yeah. I think it was definitely a learning curve. I think coming into it also, it's just I think you obviously watch any TV show when you're growing up or anything about like business, and it comes off obviously very transactional. And I think there's a certain point when you do flip it and it starts to become a little bit more, okay, I'll do this, you if you can do this for me. But I think you also just need folks who know you from like the personal side as well, um, who again can kind of be your rock when like things are going not so well when things are going very high. They also bring you down a little bit where they're like, hey, like stay level headed. But yeah, I think the connection base is definitely something that we had to learn a bit at the moment, especially when we first started. And it was very much, yeah, again, getting away from like the transactional side of things and actually speaking with the folks and learning their background and figuring out who they are as people. Because I think the other thing that kind of goes understated is a lot of our networks, especially the early stage network that we built, they ended up going on to lead teams at new companies where immediately, if we have good relationships, they bring us in almost immediately. So I think that's another thing. It's at the end of the day, it's not just like the immediate value, it's also the long-term benefit that we gain by just knowing them and
So
getting.
a CTO at company A that you've been working with goes to company
Yeah.
B, and the first thing they think of is, let's bring in Promptwell because
Yep.
they do a great job. Yeah, yeah,
Exactly.
absolutely. So it's playing the long game instead of
Exactly.
the short
Sometimes it's a
game.
little
Yeah.
too long, but it's also I'm not rooting for anyone to have to change positions unless it's for the good. So
Yeah, absolutely. All right. That's a great overview of the company and what you're doing. And uh, I've been engaged with the company for a little over a year now, or a
yeah.
year, something like that, and
Yep.
have enjoyed every minute of it. But let's talk a little bit about the podcast now and
Yeah.
what we're going to do going forward with the podcast. When Kaushik and I met, I'd had a podcast with Banner Aetna some years ago, and really enjoy these conversations. They are invigorating. New ideas come up. I get insight. I learn every time I have a conversation like this. And so Kaushik and his team decided that they wanted to sponsor a podcast going forward, and we were lucky enough to stumble on a group that does a great job, Executive Podcast Solutions. That's who's behind the production of these episodes, and I think that that makes a great team. But we're not going to be certainly not exclusively focused on Promptwell and what Promptwell does. We want you to know about it, of course, because we believe in it. But we're going to be bringing in folks in the healthcare industry from all walks to talk about the challenges that we all face in healthcare, all of us at some point. If we're lucky enough to live a long life, we'll wind up being patients. And so this is something that touches every single one of us and many of us on a daily basis. And so it's incredibly important. And we want to talk to the experts, the folks that have been out there, and we want to talk to the corkscrew thinkers too, those that don't, necessarily play directly between the lines, but may have some contrarian views about what needs to happen in healthcare. And we're really excited about the lineup that we already have of folks that are going to be bringing you their insights, their thoughts, and their concerns about the healthcare system and what we can do to approach that quadruple aim. How can we, in fact, make it so? So you can look forward to a lot of broad-ranging discussions on a variety of topics. And Kaushik, anything to add to that? Is this what made you interested in supporting this
Yeah,
podcast?
I think the big thing is actually how we look at like even just patient care in general, right? It's all about just again to your point, building trust, building education, and just providing that to others without asking for anything in reward. So I think the big thing with this podcast, what interested me specifically in our team was when you brought up the idea where we're going to be talking with a lot of different stakeholders, different folks at different various points in the industry. And it's just frankly the education side. I think a lot of what we do and what we live by as a company is, again, providing accurate information at the right time. So I think the big thing with this podcast is it lines up with our mission as a whole for a company. And especially in like the healthcare realm, I think it's more needed than ever now.
Yeah, absolutely. And I'm really looking forward, and I think you're going to be impressed with the lineup that we have. I want to circle back a little bit though, because you didn't reveal one of the key issues. You come from a medical family.
Yes, yeah.
Talk to
So
us a little bit about that. What's your mom do again?
yeah, so my mom she's down at Baycare health system. She's the system-wide CMO there. And long story, so it made the choice of not going to medical school a little bit harder, I think, for her to stomach, probably.
That's what I was
And
going to ask you about next. And people say,
yeah,
well,
yeah,
mom and dad weren't, when you said mom and dad weren't happy about that, I want to give them
yeah,
some context to why that might
yep.
be so.
Yeah,
Yeah.
and then my dad, he's an entrepreneur himself, along with my older brother. So kind of come from a family, and I feel like I'm a little bit of a hybrid of all of them, in a way.
Gotcha.
But yeah, so just from my mom's side, yeah, she obviously was in Massachusetts for quite some time, worked on like in internal medicine, then went to the management side, was in Massachusetts, worked at Tenet, Dartmouth Hitchcock, and then ultimately went down to daycare. So she's been obviously very good for us, along with, frankly, like even uh, Mike's parents, Zach's parents, where I think from our perspective, again, coming into this without much of a network, it's like, okay, we have to kind of slowly work it ourselves and kind of think about it as like a tree where it's like you get one branch, try to branch out to three more. So they've been great, but yeah, just I think kind of soaking up the knowledge when it comes to what health systems struggle with and how specifically patient engagement fits in from our perspective, but also what are the other pain points that they're facing on a constant basis.
Absolutely. So, where do you see the company going? Let's talk about maybe a 5 year plan, a 10-year plan. I mean, do you see it branching into other areas? What are you thinking
Yeah,
in
I think
terms
like a
of
lot of the,
trajectory? You know,
yeah, I think like definitely the top focus for us is always going to be healthcare. I think pharma is an interesting angle. At the end of the day, we want to be the best intelligence engine when it comes to outreach out there. We have models, they continue to improve. I think we look at some of the solutions out there right now that do omni-channel outreach, and the great thing with those is they help with the coordination of messages going out. The problem is they're not necessarily a decision layer on top of it. Like they don't create the decisions. It's the teams who are actually creating the journeys who are saying, okay, 8 a.m. for this text, 10 a.m. for this email. I think from our side, we look at it as seeing like healthcare sitting on so much data, as well as a lot of these regulated industries on each patient before an outreach even takes place. So why wouldn't we be able to build models on that data that they have and figure out, okay, the best way to engage a 58-year-old female who has type 2 diabetes is 9 o'clock or 9:02 a.m. through a text message. So really, we're trying to be that intelligence decision layer where we can obviously help with that infrastructure and the orchestration. Simultaneously, we want to also be able to work with groups who are already committed to some of these solutions that do omni-channel outreach, where they can just use our intelligence layer. But everything goes back to can you nail down like the way to get in contact with each person on an individual level and not batch send to folks and be static and be limited in terms of how quick you can iterate. So yeah, I think like big goal is to be the best model out there. And best outreach model. And I think from the industry side, again, healthcare is so ripe at the moment where just there's so much there, especially with all the incentives shifting, where I think definitely high focus there. Do see this in benefits, workforce benefits, and then also, yeah, eventually we'll see. But the financial industry, again, other regulated industries who have some data, I think that's like a interesting approach, but I'll say like our full focus at the moment has definitely been the healthcare side.
got it, got it. And so, if I heard you correctly, the automation process, not only is it a better way to reach out to members and patients, but it's also much more efficient. It doesn't require
Yes.
as many man hours to get the
Yep.
same messages out at the appropriate time. Is that correct?
Yeah, exactly. I think we think about it from the perspective of if yeah you had 100,000 individuals and you wanted to send 100,000 unique journeys with the current technology stack that's out there, that would be a little bit difficult. And I think from our perspective, you should be able to do that within 5, 10 minutes. So we've built this technology stack that can do that with kind of that core aspect being those models that are continuing to evolve for us. So it saves the teams a lot of time because again, they can focus more on how do we iterate the content as well rather than oh, like what time works the best or what day works the best because they know that they can rely on our solution for that. So then it kind of goes to, okay, are we getting the right message in front of this patient to get them to the care? And that's where the hyper iteration comes into play. as a result.
Got it. Got it. So let me ask, these are some questions that I'd have and did have at one time, and that's what are my options as a payer or a business? What are my options for? Can you work on top of other systems that I already have? And maybe I've got a legacy system in place. I don't want to rip it out.
Yeah.
Is that something you can work with?
Yes, so we can. So that's where we actually just provide our the AI models to that group. So instead of actually integrating our system fully into it, say you're in an EHR, you're using uh, one of the solutions out there, the omni-channel ones, you could actually, if you have the patient population and you have structured data points on each individual, you could pass that to us, and then we would use our models to provide the unique output. So basically the calculations back to you, and then you could be able to deploy. So we're able to sit on top. A lot of groups, I will say, they like that, but they also are like, oh, can you just take this workload completely off me,
Yeah,
off my
yeah.
shoulders? Like my team's already overwhelmed. I think our goal is also to allow teams to work 10x more efficient as a result. And uh, not necessarily have to spend time again creating these journeys. There's so much other stuff that's going on with every business that's like more important from like their day-to-day standpoint, where if we can take this one component off their hands, that's a huge win for them and for us.
So what's the lift? If I've got an IT team that's already up to their ears in projects, how much are
Yeah.
you going to ask of my team to make this happen? Talk about maybe the model you just discussed versus a fully integrated model. What kind of lift are we talking about there for
Yeah, so
my
the low
team?
lift is super quick because it's basically just you're basically providing lists to us, and then we're able to pass back the calculations, and then you can input it. We also have done like the low lift setting where we're not even integrated, and say you're a health system and you're trying to get folks into an annual wellness visit, you could say, here's 100,000 patients, here's some information on them. You send it over to us, we would do it in all a white labeled fashion, but we would be able to deploy, and that can get done within like few days. That's very quick, and really all that we need from you is actually the guardrails to follow. So you'll basically say, hey, send this for 2 weeks, only do 2 touch points, and send it within these time bounds and use only this content that I'm about to provide you. Our system would figure it out, the most optimal options. And that's frankly how we start with a lot of groups because before they integrate, they're just like, hey, can we do a test run? So it's a quick test run, a few days. And then the larger integration, that does take a few weeks. But again, to your point, that's where it's fully automated, where we basically get access to the data, whether it's us querying their systems or them pushing the data to us. And then based on what criteria someone falls into, they get sent that journey in an intelligent manner, and then we send the data back to the group. So the data at the end of the day, it all is going back to them, so they're able to track, and we're able to provide insights as well. But we try to provide multiple levers of integration based on the IT bandwidth, where we can at least just prove it out, and then almost always just folks will naturally go to that next phase where they'll want to integrate with us.
Got it. Got it. Uh, I think that viewers and listeners can now see why I was interested in this company. I hope you can. And to get back to the theme of the podcast, make it so. I'm gonna force you to zoom out now to the 50,000 foot level, Kaushik,
Yep.
and ask you the question that we're going to be asking our guests, each and every one of them, and that is if you wanted to make it so, in other words, make it happen, that we change the trajectory of healthcare in this country, that we start to turn things around with access and cost and the experience of care. If there were one thing you could do, what would it be, and how would you make that so?
Yeah, I think it's very much having again putting my the patient hat on as well as the health system and the payer hat. It's like having the requisite resources to actually get these programs to these patients somehow. I think like the clinical care, it's so good now and it continues to improve, especially with all this technology. And even the eligibility side with some of these recent developments that you have with some of the companies out there like Claude, where you're able to figure out if someone's eligible for a certain program or certain medication pretty quickly through the partnership with CMS. I think it's starting to kind of come together. I think the big challenge, though, is again, how do we present the right information to a patient and also not feel like it's forced? I think it's that fine line. So if I could find the magic pill for that, where it's figuring out what's the right balance, I think that's the biggest thing because when you look at it from a patient's perspective, if you're constantly getting told what to do, you naturally will resent it.
Yeah.
And it's providing those options, but those options have to be it has to be valuable to them
And
allow
the education behind that, so
and the
that they
education.
understand.
Yeah.
Yeah, great point. I
Yeah.
think that's a great place for us to wrap up for today. Just a little teaser for viewers and listeners. If you want to know who's coming up on the schedule, we already have booked a podcast with Scott Becker of Becker's Healthcare. We've booked one with Nathan Bays, who is used to do M&A in healthcare for a large financial organization and now is an independent investor. So he's got a different perspective on everything. So this is not a one-trick pony. We're gonna cover the breadth of healthcare from a technology perspective, from an investment perspective, and from a clinical delivery perspective. So I'm looking forward to these conversations. I hope you are too. And Kaushik, thank you so much for
Yeah,
joining
thank
us
you.
today. Do you want to give everybody an idea of how they might get more information about you or your company? Where would you send them?
Yeah. Feel free to go to promptwell.com. It's promptwell.com. And then my email is Kaushik@promptwell.com. So feel free to email. Always open to reaching out. And yeah, that's how you can get in touch with us
Kaushik,
and
thank you
myself
so
too.
much. It's
Yeah.
been a real pleasure, and we'll see you guys next time on Make It So.
Perfect. Thanks so much.